Hello and welcome everyone. Thank you for joining in today for today's webinar on digitization in healthcare industry, the next normal. My name is Sneha and I'm the marketing manager at Leo Technosoft. Leo Technosoft is the leading service provider of unique and diverse software development services. We're driving digital transformation for businesses globally. So today we are tuning in for this session along with industry experts to understand the impact of digitization in healthcare industry. So before we begin, a few things to consider for the participants. If you would like to ask any questions during the webinar, please type them into chat box and we will address them at the end of the session. Or in case we miss, we will write back to you with answers. And yes, if you miss anything during the session, don't worry. We will be sending around the on-demand recording after the session to all the participants. So without any further time, let me welcome our key speakers today, Mr. Girish Kopar, presenting along with Rinchen Kang. So Girish, I'm just introducing Girish now. So Girish Kopar heads the IT for Wokhard Hospitals Limited. So this is being after associated with Lilavati Hospitals and Research Center for over a decade. He has over 25 years of experience in the textile, manufacturing, and healthcare domains. Girish is equipped with ITIL, PMP, and CHCIO certifications. He is also a committee member of HIMSS Asia Pacific Chapter and international member of CHIME. Girish is associated with a few healthcare startups too as a technology advisor. He has been contributing to most of the publications and is very active in healthcare conferences as a panelist. Now, let me welcome Rinchen. Rinchen is CCO at Leo Technosoft. She has more than 20 years of experience, worked with technology organizations like LTS Secure, Xerox, IBM, Canon, and over the years, Rinchen has helped architect technology-based solutions for complex business objectives across functions to meet the critical business and technical challenges. So welcome Girish and Rinchen. So we are glad you could be here today to share your thoughts. And this session is going to be how this digitization is impacting, or I would say enhancing, the healthcare industry. So my first question to Girish. Girish, wanted to know from you, like how you are enhancing the patient experience with digitization.
Yeah, first of all, a very good morning to all and thanks for having me on the show. So if you speak on enhancing the patient experience with digitization, the first thing what comes to my mind is we have initially, whenever you used to visit a doctor or a hospital or a clinic, you used to carry a baggage of your reports. So digitization, if you say for a common man, what has thing reduced is now he has a health wallet. He has everything digitized. He can carry his reports on his mobile or even mail him. So that is the very significant change what has happened to the industry after digitization, because people were not able to maintain historic records, because for chronic patients you need historic records to be carried in a file or whatever non-digital listing. So that is one major thing. And second thing, in a lot of scenarios when you wanted a second opinion, so how could you send that? So that is a second major change, because that time digitization was not there, WhatsApp was not there, email was there, but obviously if you don't have the documents scanned, not everybody scans the documents. So nowadays you go to any roadside pathology clinic also, he will give you on the email. So it's now a paper to paperless now. So in scenarios where you need a second opinion that is across geography, maybe the doctor is not in your own city or your country, you can easily email him and get a second opinion directly to multiple people, not only one doctor, but you may have your friends or who can help you out. So that is a major change what I see in this industry.
Dinchan, would you like to add up to this?
Yes, absolutely. So following an expert like Girish, I have very few points to add. But exactly like I think Girish mentioned that what they have tried doing is the healthcare industry has tried making access easier for patients, which could range from things like scheduling an appointment, which could mean consultations, tests, reports, or even things like vital collection, e-commerce for medicines, right? So slowly from being a very physical kind of environment or a vertical, healthcare has moved to a digitized platform or an omni-channel finally, where they have the same kind of experience or similar experience which can be made available to clients or in physical form or as well as offline. So I think exactly like Girish said, that we've tried to make things easier for the patients, and that's what's happened in digitization in healthcare.
Absolutely.
And this is a big boon to the patients who are not mobile, because every patient is not mobile. If a patient cannot be mobile or is bedridden, so these things really help make a lot of difference to them and their families.
Absolutely.
Absolutely. Right. So Girish, my second question to you is, as we know, diagnostic play a vital role in patient care. So what kind of digitization is expected to bring up this healthcare industry into a futuristic patient focus aspects?
I think Sneha, very apt question. So there is nothing future. I think COVID has taught us a lot of things of how to become proactive in all these things. So things for which were not happening before, the new initiatives, it has technology in healthcare has actually leapfrogged in the last 2 years. That is one good thing about COVID, what I can say for the healthcare industry, because whatever resistance to adoption in technology in healthcare was there. We can take a simple example of a teleconsultation. It was always there. Telemedicine was there, but it was not a proper structured this thing. So people, uh, doctor used to share the number, but then how to uh, commercialize it. So because a doctor will say, if some patient calls me, how do I charge him, right? So it's a waste of time for him. So there is no guarantee that if you call a doctor, if you share a number, that he'll pick up your call and you'll get a solution to that. So this teleconsultation during the COVID, where a lot of restrictions were on travel and all. So this has really changed the face of healthcare. So doctors had a structure. There are a lot of startups who mushroomed up and had applications where you could first take an appointment, make a payment, and then once the doctor is sure, okay, I have received my money, then he would dedicate that time to the patient. So this is one major thing which was there, but it was not structured, and nobody knew how to structure this. So this is not a futuristic. This is actually a change now which has happened. And what this has done is now hospitals are thinking to implement this to your post-surgical patients. Like there are a lot of patients who need post-surgical support, and the patients who have undergone surgery, they need to come back to the hospital for a second this thing follow-up checkup and all. So these things can be managed now remotely because there's no need, because the doctor has seen the patient, the rapport has been established. Only thing he has to do a few tests. Then again, the test again can be done. There are a lot of IoT devices which are available now. So because the resistance of the doctors is, if the patient is not in front of me, how do I check his pulse? How do I check his BP? If there's a cardiac thing, can I get a ECG on my this thing without the patient being in front of me? So all these are the barriers which are one by one taken off. So that makes doctor also more comfortable to see the patient online, which was not happening before. Obviously, the first consultation, the doctor would prefer it in person, because but once the rapport has been established, as I said in a surgical case, or in the COVID era where travel was a challenge. So these things, the doctor were more confident of giving their judgment or the diagnosis on the patient, which was not happening over a phone because you didn't have the vital information coming to him. So, and again, there's a lot of privacy and all. These are also taken care of. What this teleconsent, and then a lot of privacy issues also there. There's a consent taken. So your privacy issue, the compliance, the vitals, everything is taken care. So this is a major change what has happened. So this is not a futuristic. This has been done, and now people are now hospitals and doctors are trying to see how to leverage on this because now it's no longer a necessity. So it's a tried and tested solution. So how do I capture this? So this is now going to real-time capturing of data also. You're not talking only of capturing of data over a period of time and just emailing, but there are devices which can transfer the data real time because in some cases it may be required, like in telemedicine, if I integrate the ICU and all, you can have the real time data. There are a lot of people who have set up an ICU at home. I don't know whether you are aware. There are a lot of startups who, for a critical patient, who need not need an hospitalization, but has to be on a even ventilator support. So such things are available, and the information can be given real time to a doctor. So these are not really futuristic. These are happening. Only thing were happening in not much. Now the volume of this is growing, because people have realized if I can get a service at home, why should I go to the hospital? So there's a mindset in terms of patients also, and doctors also quite confident because they are able to get the details. It's more compliant and it's more easy. They can take a call even when they're traveling or something like that. So this is a current change, not futuristic, and how to enhance and how to commercialize it. Doctors and hospitals are thinking on this.
Right. So Ranjan, how would you approach this futuristic patient focus aspect from a technology
Yeah.
and business point of view?
Right. So, like Girish had mentioned, what technology and adoption would have taken about 10 years. COVID made sure that we had a very short time to adopt the technology. And a lot of things are already happening, like remote patient vital collection, monitoring, real-time updates for the doctors for teleconsultation, adoption of teleconsultation, right? Now, one of the things that we see that there probably could be a change in the future is adoption of artificial intelligence. So if you look at disease like cancer, etc., there is an increase in the sample numbers, which is creating a burden on the pathologists. And further, most of the tools or processes available to them are manual and subjective, right? So while the digitization has already happened, and as Girish sir had already said that, in fact, you can set up an ICU unit within your house, right? But there are certain areas where, for example, if you have an ICU unit, there are a lot of data available, but for you to, and there's less time to respond if it is a critical situation, right? So some of these can be improved by using artificial intelligence, and that's one area where people are working in. What they hope to achieve is that they'll be able to increase the productivity, increase the accuracy of diagnosis, reduce the costs associated with diagnosis, obviously, which will improve the staff satisfaction, and finally improve the patient outcomes, which is essentially what all hospitals, healthcare institutes work towards. So I think having enabled digitization to this level, maybe artificial intelligence is something that might play a role in the future.
Right.
What do you think, Girish sir? Is there some work being done around this?
Yes, see, what has happened is digitization is having more capturing of data.
Yes.
So obviously, when you have more clinical data that is being captured, and now the EMR people have understood the importance of your electronic medical record.
Right.
So this is possible only if you have a volume of data over a period of time.
Correct.
So since now hospitals have understood the importance of data, and how can it be used. So artificial intelligence will be, it is the next logical step towards digitization.
Right.
Right. Yes. So Girish, my third question is, being, from this industry so long and, implicating, like applying all this digitization factors to your, overall work environment. If you could share with us how this digitization is, like impact seen by you, and definitely we wanted to know your future aspirations to it.
Yeah, I would like to compare this healthcare industry with what banking was here a decade back. You used to physically go to a bank for any services, right? Now you don't have to go to the bank to even open an account. So healthcare is slowly moving from taking the cue from banking, because now patient is also understood that you don't have to go. So the expectation of patient is he wants everything to be done at service at home. Obviously surgeries can't be done, but if the smallest thing like taking an appointment, making a payment, having a teleconsult, everything is possible now. So this is a big change in the mindset. So why should I go to the hospital? Is it required? Why should I visit a doctor? Is it required? So right from your appointment booking to your teleconsultation, everything is now moving to this thing. Home care has become a very, very big thing. So what this is done, there are a lot of emergence of satellite clinics, because uh, in the rural areas you don't have hospitals. But if you can have just a clinic, satellite clinic setup and a good internet connectivity, so you can have the rural patients not to travel, because typically they travel 50 to 100 kilometers, to go to a good hospital. Because we work hard, we have hospitals in Rajkot, Nagpur, where there are a lot of rural population which has to travel 50 kilometers, 70 kilometers, spend a couple of hours. So if that can be managed by setting up a satellite clinic in the remote area, where you can have the vitals, you can have a technician there. You don't need to have a doctor, or a general practitioner, or somebody at a very basic level who can just have the initial checkup done, and then the vitals can be transferred to a specialist, and then this thing can be done. So this has changed a lot in terms of these are all future aspirations, like what things are started. So as the volume increases, I believe the technology will also increase and will become cheaper also. It's just like internet was very expensive when it started. Now it is not. So once people start using this technology, then things would be better for all of us.
Right.
I'm sure Rinchin would be agreeing to this, because they're doing a lot of
Absolutely.
work in that area.
Absolutely. So exactly like Girish sir said, that I think one of the biggest areas we will see movement is, one is home care, and the other one is providing similar kind of healthcare services to remote areas. I mean, these are the two areas that were highly neglected, I think, but because of technology adoption, improved solutions that are now available, I think the remote patient chronic disease monitoring is going to increase, and healthcare is obviously going to try taking their services to a wider set of people. So I think remote OPDs, Girish sir mentioned those, home care. So these are the areas where there'll be growth, and as there is growth, the solutions would have to improve, both in terms of the quality, technology, as well as costs. Absolutely.
Yeah, even the old age homes, like Rinchin, I forgot
Yes.
to mention, because
Mm,
see, the people who are in old age homes, that is not because they can't afford it. They find it
correct.
more comfortable. So if
Correct.
this technology goes there also, people are
Yes.
thinking of adopting home care, old age homes, this technology where they
Mm,
can connect to doctors, because typically in old age homes, either the children are abroad or they are.
mm.
So affordability is there. So
Yeah.
the caretakers, the children also have a tab on their health condition.
All
So
right.
this is being spreading to the old age homes also.
Yeah. Excellent. Yeah.
Right. So Girish, yes, when it comes to any transformation, right, when we consider industry-wide transformation, so let's consider this digitization in healthcare. So definitely there will be a data which is being, which needs to be protected, right? So how do you protect big healthcare data, which is from cybersecurity threats?
Now, since people have understood the value of healthcare data, you are seeing a lot of threats which are being, a lot of attacks on hospitals. I don't know whether,
Yes.
but if you see every second or third month, you see some data being compromised.
Yeah.
Because now people have understood the value of data. Obviously, it's not tangible. You can't quantify the value of the thing, but now people have understood. So that is the reason there are a lot of threats happening. So when I say threats, so there are two things. One is in healthcare, there is security and privacy both. Because you can only not only talk of security without privacy also, because
Right.
the patient data is also needs to be private and it cannot be shared with anybody or everybody. It can't be shared with all doctors. Suppose I visit one doctor, my data should be available to that doctor only. So they go hand in glove. So security and privacy. So when I say of security, there are two factors. One is your internal as well as external. So educating your own internal people, because there are more threat inside which people ignore than outside, because access to data for internal customers like your people are using the system are more. So how do you do that? Because that is a bigger threat. They can easily email or whatever they want to take the data. So internal, that is your roles and rights. You have to have a very clear definition of what a person can access at the front desk, what a person, the supervisor can access, and what the top management. So if you're able to understand what is to be shared with whom and what roles and rights they have, that is in terms of application using. Second is your all your portable devices, because attacks come through your USB drives like a pen drive, your CD-ROM drive, because that is one if the ports are open there. So how do to whom do you give that? So that is again a challenge. That is all this has to be done by your endpoint compromise. Then again, there are a lot of IoT devices that have been configured. Again, are there following the GDPR guidelines? Are there compliance that has to be checked? That is, these are all at the endpoint levels. Obviously, at server level also, we have to have real-time monitoring, which will give alerts and block. We have to have policies where we need to. There are specialized antivirus. There are specialized security tools which are available, and this is not a job that can be done one time. It has to be done real time. You have to continuously see what threats are being, what threats have been neutralized, which machine is generating these things. So this is a continuous activity of training your internal customers, having your firewalls and antiviruses set on your server. So this is a 2 point. So and both are equally important. You can't say my internal customer is at low risk and external is at high risk. So both have to be treated in the same thing and have to be managed at the same time. And lastly, what people do is they try to use some pirated software, not unlicensed software. It's not licensed. So again, there's a compromise. So if these are all small things, if these things are taken care, I think then we are good to. Obviously, you can't say my everything is safe. There will be threats. It's like a cat and mouse game, but you have to be as vigilant as possible with all these things.
Absolutely. Girish, I think you have basically covered most of the points that I had. So what I would like to add here is some of the reasons for healthcare being one of the targeted things is one is the high attrition rates. So like Girish had mentioned that, insider threats are just as much as critical as outsider threats. So high attrition rates are one of the areas which contribute to this. Also, healthcare is the second largest targeted industry after financial segment. So like Girish again had said that the data has become important and people are beginning to realize the value of data. So that's the second thing. The third thing is in healthcare, you still have a lot of legacy systems, which might not be as secure as the newer kind of environment that's coming up. And finally, the adoption of IoT. Again, a lot of IoT devices are now being used, and you have to make sure that they are compliant, GDPR, other compliances, right? And what you need to do, again, as mentioned by Girish, training is one process. Access and authorization. So who has access to what information, devices? Is it commensurate with their roles, right? So that's the second thing. And lastly is continuous or real-time monitoring with updated threat intelligence so that you understand what's happening in your environment in real time. And if there's anything anomalous that is happening. So yes, and like I said, so I have this very interesting number that I always like to quote. So apparently by 2022, the revenue from cybercrime would be $6 trillion US. And this is more than the drug revenue worldwide. So that's the kind of, data we're talking about.
Interesting. So Girish, yes, and Ranjan, thank you. Thank you for having this thought across to us and across to the audience. My last question, Girish, as we see there is a significant rise in digital, innovations, we say, so which has further motivated healthcare companies, medical device manufacturers to explore that relevant opportunities, right? And embrace this digital transformation. So I want, like overall, we wanted to know if you could elaborate on some of the innovations which is enabled by you, as in, because obviously people would like to know from you. So any innovations which is enabled by you?
See, innovations, I think we have covered most of the points, but now
Right.
what healthcare is slowly moving to is something from a reactive to a proactive. So when you say innovations now, a lot of data is being captured. So obviously artificial intelligence to predict your chronic diseases and all these things are happening. So when you have data, you can do a lot of innovations in terms of your clinical listing, like how to predict a clinical condition of a patient, because you have future, you have the past historic data of the patient, you have your algorithm written. If this is a condition, what is possible, what is not possible, can it be converted into a cardiac or a diabetic? So all these things are happening because you are having data now. So that is, I would say that is one thing which is there, which is not there. And I think rest we have already covered. We have covered telemedicines, we have covered
Right.
home care and satellite clinics. So these are all things to come. So these are already there. So as people use more and more, it will be more affordable and more players will be coming. So if there's more competition, I think it will be uh, affordable and plus an improvement on the technology. So that is what I would like to sum it up.
So I think I have to mention here that the big contributing factor to digitization in healthcare or any vertical for that matter is thought leaders like Girish, who not only explore the technology options that are available out there, but work with their managements to ensure better outcomes for their organizations. And I think that's one of the most critical ones. So yes, other people will adopt it, but we need thought leaders like Girish to be able to enable those adoptions.
Yeah, enable
Definitely.
and commercialize those. So because
Yes, yes.
we were IT was only service department. Now people are looking how to use digitization to how to run the institution, how to drive business. So like
Right.
IT can drive the business now. That is
Correct.
a change which management has understood also, because
Yes.
if you have data points, you can focus your marketing strategies. You can have a
Yes.
focused approach to your camps and all. So that is a
Absolutely.
big change. So the how to
Yeah.
leverage the data, how to use the data and convert it into commercial listing. That is
Yeah.
what every hospital is trying to drive.
Yeah. And I think now IT has become a business enabler rather than a cost center. So I think that's a very good move.
Right. So yes, so Ranjan, any last comment from you, before we wrap up the session?
No, I'm very, very good. I had a very interesting session and I learned a few new things from Girish, and that happens with every interaction I have with him. So thank you so much for that, Girish.
Definitely.
Thanks, Richard, and thanks for sharing those numbers. So that numbers is motivate us more to be vigilant on the data privacy and security.
Absolutely.
Absolutely. Thank you. So we need to conclude this today. So we definitely we see that digitization has indeed, revolutionized this operation of healthcare industry in India. So with this, we end this session here, and we would definitely, have this thoughts, and enlightening thoughts, I would say, coming across to us and to the audience. Thank you, Girish. Thank you for your time today. Thank you, Rinchen. And yes, we appreciate you being here and joining us today. We will see you soon.
Thanks.
Thank you.